This is the news on top of the hour.
Live from our studio in Georgetown.
Kaieteur Radio, 99.1 FM.
With the time now moving on to 13 hours 1, you're listening to Kaieteur Radio 99.1 and of course 99.5 FM. Kevin Smith here with your news in a capsule. If it receives the blessings of the PPPC government, Exxon's fourth oil project in the Stavro block is poised to generate 450 million standard cubic feet of gas per day by 2025 to 2026. This is 9 times the volume of gas that would be brought onshore via the imminent $900 million gas-to-shore project, which will feed off the combined resources of the ExxonMobil-led Phase 1 and Phase 2 projects of Liza. The foregoing was outlined in ExxonMobil's environmental impact assessment in Yellowtail. In that report, Exxon explained that the project would be supported by resources from the Yellowtail and Redtail fields in the Stabroek block. It will produce material quantities of associated gas. It said a key use for this associated gas is for fuel in gas turbines for power generation on FPSO vessels. In other news, in support of regional decarbonization efforts, the Caribbean Development Bank disclosed that it has not provided any fossil fuel lending over the last 3 years. The financial institution recently disclosed that it intends to further reinforce its support for sustainable energy through its revised energy sector policy and strategy, currently under development. The CDC, that should be the CDB, made the foregoing revelation last week as part of its commentary regarding its alignment with the Paris Agreement, which seeks to bring global temperature to 1.5 degrees Celsius. And that's the news of the moment. Remember to get the full details of these stories, pick up a copy of the Kaieteur News. And don't forget, you can catch us on the MyTuner app as well as the Radio Garden app. You can also keep up to date by liking our Facebook page at Kaieteur Radio and subscribing to our YouTube channel, Kaieteur Radio Livestream. Oh, also catch our stream at www.kaieteurnewsonline.com/radio.
Keeping your hands clean is one of the most important steps you can take to avoid getting sick and spreading germs to others. So be wise and wash your hands regularly to keep those germs at bay. Get more tips for healthy living by tuning in to Kaieteur Radio every Monday at 1:05 p.m. for Your Health Matters.
Good afternoon and welcome to Your Health Matters here on Kaieteur Radio. I'm your host, Rihanna Ramsey, and our guest for today is Dr. Ruth Ann Rose Ramkelawan, an optometrist attached to the Diamond Hospital. She's here to share with us on the issue of the topic of caring for your eyes. Dr. Ramkelawan, good afternoon.
Hi, good afternoon, listeners, far and wide. So we are still celebrating World Sight Day, although it would have been gone. Our aim globally is actually to focus all attention and improvement of your vision for everyone.
Okay. So just tell us a bit about yourself. You're new to us here on the radio. We have guests every week, and you're one of our newest guests. You've been an optometrist for over 2
years.
2 years.
I graduated.
Yes.
I think it's over 2 years. I graduated in 2019. But even as I was studying, I would normally volunteer with the Ministry of Health. So I'm normally on the go with doctors into different regions in Guyana on outreaches.
Okay. So tell us a little bit about what you do down at the Diamond Hospital.
Okay, so what we do, we would normally screen, treat, and refer. Taking care of the eyes is very important, and so what I'm here really today to do is to advise you and actually implore you to get your eyes checked regularly.
And regularly, by regularly, you mean how often?
Well, normally it's 2 years. Every 2 years, you should actually have the eye screen, unless you're more prone to different diseases.
Okay. And in terms of the factors that would speak to like the risk of
Risk
having,
factors.
yes, the risk
Genetics, your work environment, all of these things could actually cause you to be at risk for different diseases. For example, last week I saw a guy. So I'm at Diamond Hospital, but I'm also on rotation at GPHC. So I saw a minor at the hospital. And so what happened is that some of the chemicals spill into the eyes. So
Wow.
these, being a different work environment would also put you at risk for having different things with the eye. And the thing with gynaes, what I would have noticed on my journey with eye care thus far, is that they don't come to get the eyes checked until something is wrong, or they realize that, okay, something is paining me. No regular checkup is being done.
And what I don't know if you're part of that any forum or anything like that, or what do you believe can be done to increase that or change that trend where persons would go and get their eyes regularly checked?
Oh, well, what we're trying to do is do a lot more awareness, because I guess if people are aware or they know, they would actually come and get their eyes checked.
Yes. You spoke about a bit of risk factors like environment and hereditary factors. How, in terms of environment, some of us work with computers, and some of us have a certain. What are some of those risky environments that you believe would put a strain on your eyes in terms of work, vocation?
Okay. So the eye is a muscle. So any muscle overwork could become tired. So for persons that do near work, right, it is very important to take
What kind of
break.
work?
Near work. Like teachers, they would normally be doing a lot of paperwork. We have accountant and so on. They would normally go through something we call presbyopia.
Yes.
This, you would see persons having a line on their glasses. So persons would think that's, oh, you're old when you're wearing that line. So persons would go through presbyopia a bit earlier than others, because the eye is actually having to do a lot more near work than it should be. So by the time you reach 40, that's when we would normally prescribe ad or reading glasses for you to use, right? But those persons that do more near work than others, they would have to use that a bit earlier. So for persons doing near work, it's very important for you to actually do an exercise. And so after about 20 minutes of doing near work, you look away for about 20 seconds, because you just don't want to put that eyes or on strain. Even for children, we're seeing it a lot now. Even persons are wearing glasses more earlier than they should have, because of the tablets and the computer and so on. They would be glued to the phone for a long period of time, and eventually the eye gets accustomed to working at that distance alone. So that's why the working environment and so on, it's important for you to just rest the eye sometime, let the children play outdoor. For persons who work in the sunlight, and not only in the sunlight, because in Ghana, in a whole, I don't know if you ever noticed some person will have a growth on the eyes.
Yes, we can talk about it. Thank you for touching on it, because we talk about that a little bit later too.
Because we live in Guyana, we're more prone to something called pterygium or pinguicular, or even dry eye. So it's the dry eye, the eye being dry, that would actually lead to that growth being there. So that's why it's important for us to wear sunshades, and even encourage our children from a tender age to wear sunglasses. And even when we go to get the glasses, you put on the protective coatings on the glasses also.
You talk about glasses, but there are some people who prefer a certain type of lens. What is the best type of lens, or is it recommended or prescribed based on the condition of your eye?
Yes, it's recommended based on your specific condition.
But in terms of sunglasses, is there a general lens that is best suited for this? sun.
For the sun, yes, there's the UV light coatings, there is Crizal, there's blue blocking lens. So based on what you would like, that's how they would actually recommend it.
How often? What are some of the questions that a person, when they visit their optometrist or their eye care specialist, what are some of the questions that they should ask?
They should ask. So, for example, if you're being treated at the hospital regularly, you should know what you're being treated for. And that's what most gynaes don't do. We were having an awareness on World Sight Day at GPHC. And so we were actually speaking to the patients of the eye clinic. And some of them, it was actually alarming that persons was going to the hospital for years and they don't even know what's happening with the eyes. So we were actually advising them, it's okay. The doctor will answer your questions. It's okay for you to find out what's wrong with my eyes. So if you're being treated somewhere, it's okay to find out what was happening to me, what happened, why am I doing this, or what can I do to prevent it or to slow down the rate? If I use my medication, will it help me? These are all questions that you should ask because your sight is very important.
And in terms of caring for your eyes, in terms, besides wearing your glasses, your prescribed lens, diet.
Okay.
What role and what can we eat?
Now, one of the first thing when we advise persons on how to take care of the eyes is that you must eat a healthy and a balanced diet. In Guyana, we have seen an alarming rate in diabetes, hypertension, and cholesterol. Now, these three things also affect the eye. So diabetes and hypertension and cholesterol also cause damages to the eye. So that's why it's very important for you to actually eat very healthy, like eat your vegetables and so on.
Okay. So we're talking about eating correctly, but besides that, is there anything else generally
to take care of the eyes? Okay, so you eat a healthy diet, you maintain a healthy weight because weight. Because when you're obese, right, that could put you at risk of being diabetic again, or even having high cholesterol, which will also lead to damages in the eye. Do regular exercises. These exercises will actually prevent or control diabetes. They would regulate your pressure, and you can also wear sunglasses like we were speaking about earlier. You could also wear protective eyewear. In wherever your workplace is, if you know that, okay, your eyes is at risk, you wear protective garment for the eyes, right? Like face shield. Some of the things that I see when we're at the hospital or when we go out on outreaches, I think I'm a bit more cautious when it comes to my eye because of some of the things that we would have seen. For example, nail in the eyes, somebody cutting chicken and the knife end up in the eyes, and these are some of the weird things that we would see. So it caused me to be a bit more cautious, right? Avoid smoking because smoking would also increase the risk of certain diseases such as cataract, age-related degeneration to the eyes. And know your family medical history. That is very important. Today at Diamond Hospital, I saw a patient. She came in and there was pain to the eye. So in questioning her, doing the case history, she told me that she's aware that her mom have glaucoma. This is where a patient may have elevated eye pressure.
Yeah.
And it could also lead to damages in the nerve and so on, right? And the thing is with glaucoma, you may have glaucoma because your family have it and don't know you have it until it's at a certain stage. Because at first it doesn't give any signs that it's there, right? So from the pain, then we advise her to go get the pressure test done to the eyes, right? And it was a bit high. So now she would actually have to start treatment for glaucoma. So having family members with different ocular diseases can also put you at risk for it, right? So knowing your family history is also important. And actually giving your eyes rest, like we were talking about earlier. So these are just some ways in which you could actually take care of the eyes.
Okay, so we'll just take a short, quick break. And then when we come back, we hear more from Dr. Ruth and Rose Ramkalawan on caring for your eyes.
You. The COVID-19 vaccine is not a cure. The Ministry of Health's vaccination drive is to remove the virus's ability to cause hospitalization. It helps to look at your exposure to COVID-19 like this. Best case scenario, you don't get infected, and the worst case scenario is death. Get vaccinated today. This is a message from Guyana's Ministry of Health in collaboration with PAHO WHO.
Welcome back to the program. You're listening to Your Health Matters here on Kaieteur Radio. I'm your host, Rihanna Ramsey, and we're speaking to Dr. Ruth and Rose Ramkalawan, an optometrist attached to the Diamond Hospital, about caring for the eyes. She was giving us a rundown of how often our eyes should get our eyes checked. Some of the things that we need to factor into our diet when taking into consideration our vision, and a number of other things that we can do. But right now we're going to go into some of the common illnesses that affects the eye, and she is attached to the Diamond Hospital, which is one of the locations that have a diabetes center. That's what you're saying. A glaucoma.
It's located at Georgetown and at Enmore, but we're gonna get more into that later on.
Okay. Yes. So go ahead. Tell us a bit about some of the common eye issues.
All right.
Diseases.
Some of the common eye issues we may see in Guyana is pterygium. That's the growth or the pinguicula. So is either pterygium, pinguicula. Is based on how, when we look at it, based on the shape of it, we know which one is affecting you. And so this actually comes about from the eyes being too dry. For example, remember our country is tropical. We have the sunshine, and then when we're not in the sun, we're in the AC, and so all of these actually cause the eye to dry out. And so having, like with your skin, if your skin is dry, you would use cream or lotion on your skin. Same thing with the eye. There are lubricants available for the eye. So once you moisturize the eyes also, like using artificial tears, some persons would use the clear eye brand. That really helps in preventing that to grow any further if you have it already, or if you don't have it, it will prevent you from your dry eye leading to that. So that's the first thing. We have conditions that we see due to the climate, right? Then we see a lot of patients will come in with either high blood pressure or high sugar levels. Now this is dangerous because when your pressure is high, you could also get bleeding. The vessels in the eyes can burst and bleed. So not only do your body go through changes, your eyes also would have those changes also. With sugar. With sugar. If you're diabetic, right, it's important for you to get the eyes checked. And that's not happening. With some persons may have sugar for 30 years and never check the eye until they realize, okay, I'm seeing blur, or I'm looking at the wall and I'm seeing flashes, or I'm seeing dots. So we would normally call that floaters, right? Where you look and every time you look around, you see something floating there. So these are signs that, okay, the eye is being affected by your sugar level.
Wow.
Yes. And so in Guyana right now, we have diabetic retinopathy clinics set up, screening clinics. So far there's 2. There's one located at Georgetown Hospital and at Enmore We will work on actually having more distributed around the country, but it takes some time because we would need the equipment and so on. Persons would need to be trained. But it's very important. So for example, if you have sugar, it could also cause bleeding of your vessels. There's a number of things that sugar can cause damage at the back of the eyes. And then, so when we realize, okay, you have diabetes, we would normally send you to the clinic to do the screening. They would normally pick up the changes happening behind the eyes. Now, if it's very alarming, they would refer you to the ophthalmologist, right? The ophthalmologist now would treat them in different ways, and either, but then the main thing is the diet. It comes down to your diet. Because persons may do laser, because laser is a treatment they would actually try to use to stop the bleeding and so on. But persons would do laser, but because of the diet, it won't make any sense.
Wow.
So you see somebody come in with vision, and then after a number of years, the person cannot see anymore because they would not have been controlling their sugar levels.
Wow. What's the difference? Glaucoma, you said...
Glaucoma. Oh, yeah. Glaucoma is referred to the pressure in the eye being a bit high, right? And so it's genetic. You could also be genetic. For example, if you have a family member with glaucoma, you could also be prone to it. And you would have to
And that is not as a result of diabetes, or that is just a result of...
No, that's something on its own, glaucoma.
Okay.
So you ever heard of cataract?
Yes.
So it's just like it's a different disease or a different eye condition also.
Okay.
Yeah.
And that how do you treat
Glaucoma?
Yes.
All right. So eye drops. We would normally... It's not curable. That's the thing about glaucoma. You can't get rid of it. Once you're diagnosed with it, the main thing we do is try to put you on a treatment that would actually lower the pressure in the eyes. There are different forms of it, but there's the main thing right now available.
And in terms of symptoms, you said that you have flashes and...
The flashes and the floaters and so on, though, that's associated with diabetes.
But in terms of symptoms for like glaucoma,
there's no early symptoms with it.
Oh my.
Yeah, there's no early. So until when patients come in and they're feeling pain and so on, then they check, it's high. But remember, you won't know the pressure in your eyes. Most time when you tell people about pressure, they're thinking about the entire body.
Yes. When you said pressure, I was thinking blood pressure. What pressure?
Yes. There's also ocular pressure, right? That's what actually keeps the eye in its shape, right? So the eye also has pressure, right? So it's either high, too high, or, so we just want it to be normal. So when you come and you get checked, we would actually do that. That's why having regular eye examinations are important, because you'll be able to, I actually checked my pressure before, things like that. You will be aware of. So it's not just going to do night tests, but to have a general eye examination.
Are eye examinations expensive, or is there a cost attached? I wonder why people don't usually do it, because
I think most time you gotta do with awareness, because you don't know the importance, and you don't actually, you don't really value something until it's gone for some people.
It's to be gone.
Or I don't know what it is. I guess you just live in day to day. Because most gynaes, like we were speaking earlier, don't go and get anything checked out when it comes to your body until you notice that, okay, I'm in pain, or nobody goes and check, let me do regular breast examination, or let me go and just check my eyes and do dental examination. Nobody does that.
But I find I've covered a few health let's call it events, and I find once they have a tent set up where people are testing their eye, people will go and get their eye tested.
I guess because it's free, and
but it's not free across.
It's free at the hospital also.
And what about at the health clinics where persons are which is more accessible?
Well, we are going to be doing programs in the future where we'll actually be going to the health center, making healthcare a bit more accessible, eye care a bit more accessible to all. Because most time, so far, optometry is actually a new thing in Guyana, and the hospital in general. For a number of years, Ghana didn't have it, but it's here now. And so you could actually go to the hospitals and actually get the eyes checked, or even speak to ophthalmologists. We have those persons that are really specialized there also. So we have you can come to Diamond Hospital and have an examination done, eye examination, Linden, Georgetown, and more over the river, Port Morant. There are different locations we have up and running so far.
So whenever you visit the hospital, you can go into these
Yes.
health clinics, hospitals,
Yeah.
hospitals
Hospitals
basically.
right now we're at.
And you can get your eyes checked, and it's free of cost.
Yes.
So you don't have to worry, and you don't have to wait until there's a health fair to just run in a line up to test your eyes.
Yes.
Okay. We're dealing with COVID-19, and I must ask, do you know of any effect that COVID-19 has on the eyes?
Has on the eyes. Okay, so based on studies in the past that I would have read, the only thing 1 to 3% study would have shown that persons with COVID can also develop conjunctivitis, or we would call the red eye in Guyana.
Wow.
And we know that is treatable. But that's only a 1 to 3% so far. So far, the studies, that's the only thing that they would have shown.
Okay, so you can get some amount of symptom because
Yes.
basically COVID is just show you symptoms. The actual virus, it attacks other
Parts.
organs
Organs.
in your body, but it can the symptom could be a red eye or the coughing as well. In terms of general symptoms of having like a damaged eye or defective eye, or your eyes going bad. Headaches, how common are headaches?
we have a lot of persons would come straight to the optical center if they're having a headache. Now, there are many causes of headache, but having eye strain could also lead to a headache or migraine, right? So, okay, before we go to that, I just want to leave the number with persons. If you know that you're diabetic or you have any family member that is diabetic, or even your friend or your neighbor, you can call this number. There's our hotline number, and you can make an appointment to come and do the screening for the eyes, where we'll check the back of the eyes, right? The number is 227-5519. 227-5519. And that's the number for the center at Georgetown Public Hospital.
And they're they make you get appointments, so you
Yes.
don't have to go there and line
No.
up.
It works by appointment and really effective services.
So persons don't have to be afraid that when they go there, they'll have to line up and they have to wait. No, you go, you call and you make your appointment, and they set a date for you, and then you go in, and it's quite quick and easy, and it's the best way to know how.
Yes, to know how the eyes is doing if you're having any
And
damages.
it's better that way.
Yeah, because it's always better to know what's happening, what's
Early,
going on with the eye early.
We'll just go to like a short break, and then when we come back, the time is running pretty quickly. We'll have more from Dr. Ram Kalawan on caring for your eyes.
Kaieteur Radio, keeping you informed.
Demerara and Essequibo 99.1 FM.
Burby's 99.5 FM. Kaieteur Radio.
Welcome back to the program. You're listening to Your Health Matters here on Kaieteur Radio. I'm your host, Rihanna Ramsey, and we're talking to Dr. Rutan Rose Ramkelawan, and she's from the Diamond Hospital, and she's talking to us about caring for our eyes. Before we went to break, we were talking about some of the common eye diseases and how we can treat those and where you can go to get help. She gave out a number for those who need to get screened for diabetic retinopathy.
Yes.
And so we're moving along and the time is going. So she spoke also about those who are working, their vocation causes them to put strain on their eyes, what you can do in terms of protecting it. But we want to touch on some other issues, which is we have some things. Sometimes we hear people say when they have their eye, oh, my eye is jumping, I'm gonna see somebody. But that is actually a condition, and it is a result of something happening to the eye. Can you talk about that?
Okay, it could also be as a result of persons that, remember, if you're doing a lot of near work, or you're on your phone for hours, or you're just...
and near you mean like pressure, pressure point work to your eye, like having to study or stare at a computer for a long period of time, right?
All of this could cause the muscle in the eyes to feel a bit tired, causing that twitch. And then some persons, we have a condition called Nystagmus, where that will be uncontrollable movement. You'll see the eyes just moving all the time.
Twitching all the time.
Yeah. It's like a movement, but the uncontrolled. So you'll see it in persons like with that are albino, they would normally have this also. So there are different conditions that would cause things to happen to the eye.
So it had nothing to do with seeing nobody or bad luck.
It could also be, when there's strain on the eyes, could result in that twitching. Or even some persons would say, I feel heavy. It's also important to give your body rest. So when you sleep and wake up, back is okay.
There's also the issue of a lump being developed along the eyelid.
Okay, so that's different condition also. So for example, if you wear makeup and you don't clean it properly, so there's the pores there also that can become blocked.
Wow. Or
if you're somebody that likes to rub the eyes a lot, you could also cause an infection, and that's why you can end up with that. Some people would say, oh, I get cat eye.
Cat boil.
Cat boil, yes. I take back something from somebody. No, it could just be that one of your pore became blocked up, and or even when some persons would use mascara and don't actually properly clean the eye. And so that could cause different things in the eye. So that's why I tell you, when you are aware of certain things, you would do better. I saw a serious case of uveitis, an infection to the eye, from somebody wearing contact lens, also makeup artist. And she was telling me, I just put it in, one time. But then it's very important to know what you're actually putting to your eyes. Taking care of the eyes is more than just wearing a glasses. It's or a spectacle. It's every day making sure that, okay, I have to take care of this because I can't just go to shop and buy another one.
Yes, true. In terms, you talk about that, but there's also the cyst.
Yes.
How do you treat a cyst on the eye?
Based on which one of the lid, we would normally either do compression or massage. We would give ointments. But when you come down to the hospital, then we'll be able to diagnose you properly. Because most time persons would just go at the pharmacy, and sometimes they would use things and you don't even know what you're using is correct. They use stuff and then they come to you and then, it's the wrong thing they would have been using. Yes.
And it's dangerous to use eye drops without the correct prescription.
Without a prescription.
There are different types of eye drops as well. And there are some that contain things that can be lethal to your eye, deadly, deadly, blinding. You can get blind actually from some of these things. So you have to be cautious. So you just can't go and use your grandmother eye drop because you realize something is wrong with your eyes. Oh, my eyes itching me, running. You go use somebody eye drop. No, there are different
eye drops that would look after
For
different diseases or different eye conditions. But one of the things that we would recommend, like we were speaking about earlier, is that to use something called artificial tears. It does a lubricant. And just like how you would keep your skin moisturized, it's important to keep the eyes moisturized as well.
And
You could get it at the pharmacy.
and that is, you have to ask for that.
Yes, you can ask for that.
But for the, what was it called? The
Artificial tears. Even some supermarkets I see sell them right now.
And those are over the counter, and those are safe to use.
Those are over the counter and safe to use. But then you don't use it for the entire year.
No, you have to make sure that you store it correctly.
Yes.
And you don't use one that is expired, because you
Yes.
put your eyes at more risk.
It's important to check expiry dates also on your eye drops.
And we have some allergies, not a lot over here, I guess,
Yes.
but there are some eye allergies that can cause, if you don't treat them, vision loss.
All right. So allergies is important for you to actually come and get when you realize, okay, the eye is tearing, when you have allergies and so on, it's okay to go and check a general doctor, because, some persons would have sinus.
Yeah.
And then sinus could also, your sinuses could also be infected. And then when the sinuses are infected, it could also affect the eyes. I recently saw where somebody had sinusitis. Their sinuses were sinus was infected, and then it caused the eyes to become infected. But because they took such a long time to come to the hospital, by the time they came, the eye was actually pushing forward, and it was, and it was, every time when you're at the main hospital, you see so many different things. So, and you're always learning each day. So if you realize that you have an issue with your allergies or with sinus, it's okay to go and get a checkup. And not just to go and use anything over the counter just like that. After a while, you keep going to different pharmacies, using different things, and you realize, okay, my allergies are still affecting me. Go and get checked up.
Because I find that the eye and the nose, they work in tandem.
Because of how it's actually located and so on. Because the tear duct actually comes down here.
Along the nose.
So that's why you have tearing, and the nose would run and everything together.
So it's common when you see something affects your eyes or your nose, your eyes will your eyes will respond as well.
Yeah, and also persons with allergies will tend to rub the eyes a lot. Or I don't know, somebody once told me at the hospital, it feels really good to rub the eyes. You have a feeling in which you feel out of the world when I rub the eyes. But when you constantly rub the eyes, you change the shape of your eyes, and that could also lead to a different condition called astigmatism, in which when you come to get your eyes checked, the optometrist may be showing you one letter, and you call it a totally different letter from what you're seeing. For example, there is C, and some persons may be calling it a S or so on. So you actually are damaging your eyes when you rub it. It's not an out-of-the-world sensation. You're damaging the eyes.
You touched on contact lenses. And if a person is if they go down that road, instead of using glasses, they're wearing contact lenses, what are some recommended ways to care for those lenses? Because some people sleep with it, I'm told. I don't know how
and
true.
that's very bad.
But some people do it, right?
That's not wise for you to do. You must take it out. You must put it. So normally there are solutions. When you go and get your contact lens from a optical center, they would actually advise you on how to take care of it, and you must follow that, because you could end up with different form of conditions from that also. You can infect the eyes, but contact lens is not just to see out of it. There's also the doctor could also prescribe contact lens also for different conditions. So
And when you're like in terms of cleaning it, I know
solution.
I heard persons who wash it, and I'm thinking, doesn't they have a solution that comes along with it? to
Yes,
clean
it has a special solution. If you're going down the road and you're going to be using contact lens, you will have to follow a strict regimen on how to take care of it or how to use it, because the same way in which you want to see, you would also should protect the eyes while using it, and don't want the same contact lens, which is supposed to improve the vision, could cause you harm to it.
In terms of glasses, some people, when we wearing glasses, wearing the glasses according to the prescription of the doctor can result in you rolling back some of the issues that your eye has. How often do you see that happening in terms of persons wearing the glasses and then they come into a place that they don't have to wear the glasses anymore?
Okay. Well, when you have different conditions, you would use different prescriptions. And so for some, the glasses over the years can better the vision. Well, with some, it wouldn't cause the vision to get worse in any way. For example, like if persons have headaches that results from having a issue with the eye, when you wear the glasses, then that issue with the headache would actually stop. And so the spectacles would improve the vision.
And if somebody is a little bit basically not inclined to wearing glasses and their eyes are going bad, is there any other thing that they can do to like care their eyes or keep it from, I don't know, probably?
So like again, there's different conditions. So there is something called short-sighted. Some persons would say short-sightedness, long-sightedness. So based on your conditions, there's different treatment other than having spectacle. So for persons that are high myope, they would also try to do a laser treatment to better the vision.
Wow.
Yeah, different condition, different treatment. Not just spectacle is the only thing to get the eyes looked after, right? So it's based on your conditions.
You spoke about the clinics earlier, and we're about to wrap up. The clinics, in terms of the diabetes and the diabetic retinopathy, give us back that.
The number.
Yes, before we go.
Okay.
And then you give us a little bit, remind us how to tips.
All right. So if you have a friend, a neighbor, a family member with diabetes, you can have them call this number for them to get their eyes screened. The number is 227-5519. And based on your location where you live, they'll be able to put you on to either the Enmore Clinic or the Georgetown Hospital Clinic.
Okay.
Yes.
And those are the two?
Yes, two we have so far
in the country. And there's plans to broaden that, service. Just before we wrap up, just tell those who are listening and those who are viewing via Facebook give them some simple tips on how they can care for their eyes. And you can just give them like your email or something just in case they want to follow up and have a question, because we always give our viewers and listeners a chance to ask questions.
Okay, no problem. So there are things you can do to help keep your eyes healthy and make sure you're seeing it best. Eat a healthy, balanced diet. Maintain a healthy weight. Get regular exercise. Wear sunglasses. Wear protective eyewear. Avoid smoking. Know your family medical history. Know your other risk factors. If you're wearing contact lens, take steps to prevent eye infection. Wash your hand well before you put them in and take them out. Also, follow the instructions on how to properly clean them and replace them when needed. Give your eyes a rest. Very important in this technological age.
Yes. And Dr. Ram Kalawan would have mentioned, and a lot of us don't know this, that rubbing your eyes can cause damage.
Yes, to the shape of the eyes.
So if you like the shape of your eyes, please don't rub it. Please try to get over-the-counter, eye drops.
Yes, artificial tears.
artificial tears that you can throw in the eyes and wash it instead of rubbing it, so that you don't damage or change the shape of your eyes. Okay, so that brings us to the end of our program today. I hope those who listen enjoyed and they got something, some tip, or they took away some tip on how to care for their eyes. We would just encourage you to stay safe and be good to yourselves until we see you on our next program. Thank you and have a pleasant rest of the day.